Well, let's cross live now to the US and speak to Dr. Anand Swaminathan. Thanks very much for joining us. Do you agree with this decision? Do you think it's the right time to lift this restriction?
Well, the restriction itself is totally outdated. It doesn't keep in line with what we know about COVID. Getting a test 24 hours before, or at some point it was up to 3 days before, isn't really going to protect people. So we need to have better policies. This one doesn't make a lot of sense, but air travel is still a high-risk situation to get COVID and transmit COVID to others. So we do have to have some things in place to protect each other. And the airlines have been very vocal in trying to repeal these restrictions. What they haven't been vocal in is in actually doing things to protect their passengers and to protect their staff. And so what we could see that could help with that is a rapid antigen test immediately before boarding, maybe a more embracing of masks, which have a huge role in preventing transmission, and then real ventilation. We know that when you're sitting on the tarmac, that ventilation that is in the airplane isn't really running. That's a high-risk time to be transmitting to others. So I think the airlines are right in wanting this to go away, but they have to also come back with some real restrictions and some guidelines to help to protect their passengers.
And obviously, you can't put the window open when you're in the aircraft either. But you are necessarily taking a risk, aren't you, sitting in close proximity to lots of people? But many people want to take that risk and travel more freely now.
Yeah, it's a big risk when you're sitting in an airplane with a bunch of people that you don't know, especially when they're unmasked and that ventilation isn't running. And it's not just about the risk of that individual contracting COVID, but also of spreading to those that they're visiting.
So when you say more practical efforts to try and keep the numbers down, you listed some. Can you give us any more in terms of what needs to be done? And are you worried that as travel opens up this summer, by the end of the summer, the numbers of COVID internationally will go up again?
I think that we are really looking at a possibility for another surge during the summer, which, let's be honest, we're in a surge right now, and we're not really embracing the public health measures that can help to protect us. Again, I think for airlines specifically, run that high level of ventilation while you're on the tarmac, while you're at the gate. Once people are boarding, there should be high level of ventilation going on. I understand that costs the airlines more, but that's the cost of doing business and protecting those that are on that flight. And of course, bringing back masks, high quality masks, would be another measure that can really help to protect people.
And in terms of new variants emerging, if something does change for the worse over the next few weeks and months as everyone moves around a bit more, how quickly is it likely that we'll know about that?
That's really the hard thing. By the time we're detecting those new variants, they've already spread quite a bit within the community. And so it's very hard to institute policies to protect us from getting a variant to come over to the States or any other country for that matter. Those are probably not going to work. Even with a better level of monitoring, of contact tracing, it's still going to be very hard to really stop those variants once we start to detect them. So we probably can't prevent that. What we should be focused on is minimizing the risk of those that are on the plane and then subsequently the people that they're interacting with after they get off that plane.
So if people are flying and they want to protect themselves as much as they can, presumably just wear, one or two of the highest quality masks that you can get hold of. That's really all you can do and keep your hands clean.
I think so, absolutely. Good hand hygiene. Keep that mask on. I don't really understand the move to get away from masking on planes when you're in that tight quarters. So I think those are things that we can clearly do to protect each other.
OK, very good to speak to you, Dr. Anand Swaminathan. Thank you very much.